Collins. I'm a professional services consultant with Visualutions. Well, actually I was previously I worked for an attorney, and I thought that was going to be my long-term goal. And it kind of panned out that it didn't work out that way. So I had a better opportunity with an OBGYN who offered me a position and said, come on board. And it was a small office, so I was able to do everything from the front end all the way to, he sent me to school for phlebotomy, and I was drawing blood and helping with procedures. So I've always liked to kind of grow in those positions. Unfortunately, he left. He was going to move out of the county and go somewhere else. So I liked the healthcare. At that point, I was very passionate about healthcare. So I went into the public health department in our county and started there as an interpreter. Because I'm bilingual, I can speak Spanish as well. So with them, I kind of, again, grew in my position, was overbilling, and noticed how they impacted their community in the public health realm. And I kind of then drifted into, I wanted to get into a little bit further into the community, and went into an FQHC in our county, and went in straight into behavioral health, which is a very different compared to the healthcare that I was in, and realized that the patients that we had needed these services, and I was very passionate in behavioral health, loved what I did, and then I got into the billing there at the FQHC and ended up being overbilling as time progressed, and so that's kind of my background as far as why I'm passionate about healthcare at this point and love what I do. I think that I can relate to their patients just because of my personal background and how FQHCs impacted personally my family. I was previously, as a child, from the age about 7 to 13, I was a migrant worker with my father. So my father has grown up being, a migrant and working in agriculture. So I think that is something interesting about me to be able to relate. I always like to tell my customers, I'm your patient. I have been you and playing and being involved in those roles in your community health centers, and I can relate and understand. But I always say you could be providing services at anywhere, because I come from private care, and then from a community health center, and then an FQHC. So I know that their ability to work anywhere is there and open for them, but they choose to work in these FQHCs, in these community health centers, and their roles are very vital, and the services that they provide are important for their patients. So I'm passionate and I respect the fact that they're in those roles serving their communities. So that's what I love about it.